Hello, and in this video we're going to have a look at what exercises can I do to help control my wind and poo. So just a little refresher on kind of pelvic floor muscles, and then what we'll do is look specifically at the muscles in your back passage, so your sphincter muscles. So if any of you have watched the anatomy of the pelvic floor video or the just generic pelvic floor exercise video, this will just be a reminder. If not, this is something that may be new for you. So our pelvic floor muscles are a hammock of muscle, and they go from your pubic bone at the front and they come underneath and they attach into the tailbone at the back, and then they span the entire bottom of the pelvis, so they attach to the sides of the pelvis as well. Okay, so now we're going to look more specifically at the sphincter muscles. So just a kind of an overview here. We've got our bowel that comes down into our rectum, into our anal canal, and then this is the opening, okay, and the sphincter muscles are around this area here. So if we look at another view of this, so this is a view as if you were looking from the bottom upwards, okay. So what we have is a muscle called our external sphincter muscle. Now when you squeeze around your back passage, this is the muscle that you can feel tightening, okay. This muscle hugs another muscle, which is called your internal sphincter muscle, and that's this kind of magenta colour here. That muscle is not under our control. It is responsible for most of our continence, but it's like our heart. It just does what it needs to do when it needs to do it, and we don't have any influence over that at all, okay. This is just a slightly different view of those muscles. So this is, imagine you were looking through the side, okay. So you can see here we've got the rectum, so this is where the poo is stored, okay, and then we've got the anus, which is obviously where we poo from, and then here this purple muscle is your external sphincter, and then this magenta muscle here is your internal sphincter muscle. All right, so what happens when we need to go for a poo? The stool travels down, it gets to this area here where there is a ring of nerves, and that's going to tell us whether this stool is a solid stool, whether it's more of a liquid stool, so a loose stool, or actually whether it is just wind that we're going to pass. Okay, if we are at a time that we can go to the toilet, we would obviously just go to the loo. Or if it was wind and you were somewhere quiet and you could just let that wind go, you would just let that wind go. If, however, you're in a place where, say you're in the middle of the supermarket and you get that sudden feeling that you need to go to the toilet or that you need to pass wind, this is when we would start to use our muscles to help to control it. So what would happen is we would tighten the external sphincter muscle, so that's squeeze and lift around the back passage. That would then signal that this stool needs to move back up, okay, and it would then be stored again in the rectum until a time that we needed to go to the toilet. Obviously, if you are leaving it for a long time, it may be that you get that feeling you need to go again, and you have to repeat the same process until you're closer to a toilet and able to go. All right, so that is what should normally happen. There can be weakness in these muscles though. So in the sphincter, the external sphincter muscle, there can be weakness, but there can also be weakness in this internal sphincter muscle. Now for females, one of the big causes of weakness in these muscles is actually childbirth, particularly instrumental deliveries, so things like forceps or vacuum extraction, so ventouse deliveries, because there's just more stretch on those muscles. And it can just cause some weakening of those muscles. The other factor can be if you've had a significant tear during delivery. So you may have been told that you've had a 3rd or 4th degree tear. Now with a 3rd or 4th degree tear, there is going to be another video related to this as well, so it may be something you want to look at. It can actually tear, so the tear can extend into either the external sphincter muscle, or if it's really significant, it can extend into that internal sphincter muscle as well, which obviously affects how those muscles work and can cause some weakness of those muscles. For both male and female, weakness of those muscles can occur just with aging. So as we get older, everything starts to decondition. So those muscles can become weaker and not work as effectively. But also things like if you've been repetitively heavy lifting, if you've had a really heavy manual job and you've repetitively lifted heavy objects, that can cause weakening because it just causes stretching of those muscles. Constipation is another one as well, because that strain, that pushing down, causes stretching and weakening of those muscles and just affects their ability to work the way they once would. So how do you do sphincter exercises? So this is the same for whether you need to delay that urge to go to the toilet. It does vary slightly with the delaying the urge to go to the toilet, so we will talk a little bit more in depth about that. Or whether you need to pass wind. Okay, so the concept is a squeeze and lift around your back passage. So what you should feel is a tightening of those muscles internally. At the same time, you may also feel that tightening is working forwards because of the kind of the way that the sphincter muscles fuse with your pelvic floor muscles. You can't isolate one from the other very easily at all. So you may feel that tightening moves forwards towards your pubic bone, and you get that sensation as if you were trying to stop yourself having a wee as well. All right. So you get that feeling that you need to go, you need to pass wind, and you're in the middle of a busy supermarket. What you'll do is you'll do that squeeze and lift. Imagine that you're sucking up spaghetti through your back passage, okay? That's one way to describe it. No one should know that you're doing it. So what you shouldn't feel is your buttocks squeezing, okay? Particularly if you're sitting, what people would notice if your buttocks are working is you'd be bobbing up and down on the chair, all right? So it shouldn't be these big buttock muscles working. It shouldn't be your pelvis moving. So you shouldn't be rocking your pelvis to try and activate those muscles, or you shouldn't, if you're doing them in sitting or lying, it shouldn't be lifting your pelvis up off the bed or the chair that you're on. And also you should be able to talk as you're doing the exercises. So if you're holding on to everything as tight as you can, you're probably not doing those exercises quite as well as you should be and as effectively as you should be. Okay. So what we need you to do is 3 different types of exercises. So we've got our strong short squeezes. Now with your strong short squeezes, you're going to squeeze and lift around that back passage as firmly as you can and let that muscle then relax fully. And then you'll repeat that again. So squeeze and lift as firmly as you can, let that muscle relax fully. You're aiming, if you can, to do 10 repetitions of those 3 times a day. Now, that may be quite challenging to start off with. So if you feel that you're getting to 4 or 5 repetitions and actually you're starting to feel that that squeeze isn't as strong, or you're starting to notice your buttocks are working, or you're starting to hold your breath, it's probably just that those muscles are getting tired. So you rest and you gradually build it up, and we'll talk about progression in a minute. We then also want you to be thinking about doing some strong long squeezes. So with your strong long squeezes, you'll squeeze as firmly as you can and you hold that squeeze for up to 10 seconds. Then you let that muscle relax fully and you repeat it again. The same with your short squeezes. If you feel that you cannot hold that squeeze for 10 seconds, that's absolutely fine. You just hold it for as long as you can where it's a nice strong squeeze and you gradually build it up. And then you're aiming to do that 10 times, 3 times a day. But again, if you can't do it 10 times, just do what you can and you gradually build it up. All right. We're also going to ask you to do a 50% effort squeeze. So with the long squeezes, I've said we want you to squeeze as firmly as you can and then you let that muscle relax. With your 50% effort squeezes, you're not going to squeeze as hard. So you're going to squeeze about half of that and then you'll hold it for as long as you can and then you'll let that muscle relax and you'll repeat that again. So squeeze at 50%, hold it as long as you can and you let that muscle relax. The way that that works with deferring that urge to go to the toilet, imagine you've gone for a run and you go as quick as you can, but you can't go as far. If you were to run a little bit slower, you'd be able to run for a little bit longer. So essentially, that's what we're trying to get you to do. if you're not putting as much effort into it initially, you're going to be able to maintain that effort for longer than if you went all out, where that muscle would just tire quicker, and then you wouldn't get the length of time needed to defer that urge, which is about 15 to 30 seconds. All right, so that's what the difference is between your really strong long squeezes and then your 50% effort squeezes. So looking at exercise progression. So you've been doing these exercises for a little while and they're starting to feel a little bit easier. You may also be thinking, what position do I do these exercises in? Lying, sitting or standing, it's really how you feel and how well you feel those muscles working. Lying is the easiest position because it takes away gravity. The more upright you become, the harder it becomes because you start to load that muscle. You essentially add weight to that muscle and make that muscle work a little bit harder. So if you can do those exercises easily in lying, you try to do them in sitting. If you can easily do them in sitting, you try to do them in standing. Ultimately, standing is the position we want you to be able to progress into. It's the most functional. It's when you're moving that you're putting the most pressure on those muscles, and you need those muscles to be working effectively. So you start those in lying, and actually lying is difficult enough for you initially. But over time, doing them in lying becomes easier. So then you move to a sitting position. And then sitting, you do them. Over time, it becomes easier. You move to your standing position. All right, so that's one way you can challenge it, change the position that you're in. The second way is increasing your number of repetitions. So where I said that you may not be able to do it 10 times to start off with, if you can only manage 4, and then that becomes easy, you then start to do 5, and that's where you then start to work up to that 10 repetitions if you're able to. And you may never get to 10 repetitions, and that's okay, as long as you're working those muscles effectively. That's going to help to improve the strength, and it's going to help to maintain the strength in those muscles ultimately. And the third way that you can do it is with your long squeezes. So your strong long squeezes and your 50% effort squeezes, you can actually increase the length of time that you're holding as well. So it may be you're only able to hold for 3 seconds to start off with. Over time, and it's going to take a little bit of time, it's about perseverance. We know that changes in those muscles may take up to 3 months to kind of become noticeable for you. So keep with it, but over time you may feel, actually I can hold for 3 seconds, that's really easy, I'm going to try and hold for 4 seconds. And that's another way that you can help to make those exercises a little bit more difficult. If you have any questions at all, please do not hesitate to speak to a physiotherapist, all right? We are always here to help. We don't want this to take away from actually coming to see us, but hopefully this has been useful for you. Thank you.